It's fine. So we've done temporomandibular joint surgery for this lady along with some extended jaw surgery and orthodontic surgery. I'm going to show you what all we've done. She couldn't open her mouth basically for several years. Sorry, madam, are you okay? Bus. So we're taking off the adhesive plaster now. Okay, right. Move fully, madam. So she's able to open her mouth. You can see now with so much of ease. Bite. Band karo. Open karo. Band karo. Right. You can see this. The staples here. So I've done surgery all the way from here. So all of these sutures we've already removed. You can see the scar is hardly visible, but you will notice that there's a faint line. There's one suture right at the end that is still left, and these staples are there which we will remove in a couple of days, but it's healing very well. So this was the approach we used. We went inside the temporomandibular joint, it was ankylosed, that was released. The flap and the parietal thing was post interpositioning thing. Then we also worked on this side of the joint, but I worked on the left joint from inside the mouth, and then we worked on her chin. We brought the chin forwards, and then you can see the improvement from before to now. Anyways, hers is not a cosmetic case. मैंने तो easy case. चलो मुंह खोलिए. हाँ. या बताओ. या देखो. नहीं. मुंह खोल के कितना साल हुआ है अभी आपको?
लगभग अपनी जानकारी में पहली बार।
आपकी जानकारी में पहली बार? अभी तक कभी भी ओपन नहीं था आपका? बाप रे। तो कैसा लग रहा है?
अच्छा लग रहा है।
अभी देखो मुंह के ऊपर में सेंटर में थोड़ा गैप छोड़ा है, तो वहाँ से आप खा सकती हैं। तो बिकॉज आपका दांत ना 20 साल ऑलमोस्ट से बंद था, तो दांत भी थोड़े बड़े टेढ़ा बिढ़ा है, वो अपने आप सही होगा और उसके बाद आपको डेंटल ट्रीटमेंट करना होगा। आप 6 मंथ के बाद कर सकती हैं जब ये पूरा सेटल हो जाए, ठीक है ना? So you can see the mouth opening. She's opening her mouth for the first time. She says that she can ever remember. So that's such a big problem that she had. She had an earlier surgery done. That didn't work out well for her. She had what is called as a recurrent failure of that surgery. There was a re-ankylosis. There was a large bony mass that was sitting here. It was 3.8 by 3.9, so about 4 centimeters by 4 centimeters, this big. Both the dimension, that was removed. This side jaw was also fused because she couldn't open her mouth for ages. We're going to show you all the views for her. Let's show this. So you can see the improvement in the overall shape, mouth opening, that's the main thing. There's neck angle, you can see one. You can see that. See that improvement. So we've got a entire neck angle. आप देखिए मैडम, पूरा आपका jaw line आया है. यहाँ पे तो पहले jaw ही नहीं था. And then we're going to show you this side also. Oh side देखिए मैडम please. Like this. You can see that again the improvement. So she's got not just the neck and the lower chin defined, but you can see this length. You can see the height of the chin, this difference. So it's a whole face that we've worked on, and most importantly, we've taken care of our functional issue, major problem. Imagine not able to open your mouth. You can't even speak properly, forget eating, and that was a problem. She couldn't open her mouth. That was a mouth opening. This was 4 millimeters, and now she can open 4 centimeters. अच्छी तरह से मुंह खोलिए अभी, और look at that. That's just 1 week now after the surgery, and this is going to get better. We've got the elastics to guide, because you know when we've done a lot of work on the bone and the muscle, we need the elastics to put the bone and the muscles to work and to guide the occlusion. That's the reason. That's temporary. It's going to be there for probably a week more. So we've added the braces after the surgery. We've not put the braces first up and then done the surgery. Right, बंद कीजिए. यहाँ पे थोड़ा सा दर्द हो रहा है? दर्द हो रहा है. Okay. Okay, so we can just clean up intraorally, remove all the elastics, do oral prophylaxis, and then after that, all the oral prophylaxis, alternate ones can be removed first and seen. This one can be removed or finished, and then leave her like that for a while, and then again put the elastics. It may be like this, leaving the center, only the two sides, so she can surmount it. Okay? Right. Yes, yes, she goes on. आज आप जा सकते हैं, लेकिन कर नहीं. फिर आपको वापस बुलाएंगे 4 दिन के बाद. तो आप ऐसा करो, सैटरडे को प्लान करो. सैटरडे को शायद हमारा काम हो जाएगा पूरा, बट जल्दी में मत करो. Remove little alternate tables first.
Nice.